You're listening to Vet Synapse, a podcast connecting the world of research, innovation, and practical help to the veterinary profession. I'm your host, Dr. Philip Judge from Vet Education. Let's get connected with Vet Synapse. Hi everyone, it's Philip here from Vet Education. Welcome to another episode of Vet Synapse. Now, I am thrilled today to welcome two outstanding human beings to the podcast to talk about chronic pain and behaviour. The first speaker I want to welcome is Elena Wilse. She is a physiotherapist from Elevate Animal Physiotherapy, which is based in the UK. I'm going to ask her to tell you a little bit more about Elevate Animal Physiotherapy in a second. And the second person I want to welcome is Findy Wilse, and she is from Let's Talk Paws, which is a veterinary behaviour service based in Sydney in Australia. They're working together, and best of all, they're working with us as well at Vet Education. Welcome to the podcast today. Today we are going to be talking about chronic pain, how challenging it is to diagnose, how we can get better at it so that we can then begin to embark on effective treatment for our patients. So I want to start just by asking you both just to tell us a little bit about yourself, how you got into this field of animal pain, its relation to animal behavior, which we'll chat about a bit later on. Elena, let's start with you.
Thank you. Hello, I'm Elena Wilse. So I'm the founder of Elevate Veterinary Physio, and while I've always wanted to be a veterinary physiotherapist, I actually started my journey becoming a human physiotherapist first. So that was actually following the advice of a senior at the time. So I went on to work in the NHS hospitals here in the UK before transitioning to private MSK practice and rehabilitation. And then I went on to working as a functional assessor, where essentially that meant that I was assessing a person's holistic health. So that's inclusive of their mental health, their physical and neurological health, and their capacity to work. Before I then went on to completing my postgrad and master's degree in veterinary physio from the University of Liverpool. And that's when I started my own business. And while this was the longer path to take, I know that this has given me more of a unique edge in understanding movement, behavior, and essentially the whole holistic care across species. So in the last year, I've been focusing on expanding Elevate's online gait analysis service and online physiotherapy to support more dog carers and professionals to understand the presentations better and provide suitable treatment for dogs that struggle to access clinics or in-person care due to their behavioural limitations. But over the next few years, my mission is to build a global movement that empowers dog carers and professionals with the tools to create better outcomes for behaviourally challenged dogs. So I'm really excited to be here. Thank you for having me on.
Wow, that's an awesome introduction. Thank you so much for sharing your journey with us. And I can see that and what we're going to talk about today, you're going to have a lot of great input. I'm very excited. Stick around to the end of the podcast because we have some really exciting news for you as well. Findy, welcome to the podcast. Tell us a little bit about your journey.
Yes, thank you. I mean, I'm still stunned by like all of Elena's professional qualities, and that's why we work so much together. But I'm Findy Wilse, and I'm the founder of Let's Talk Paws Veterinary Behaviour Services. So I'm a behaviour vet. I've got my master's in clinical animal behaviour from the University of Edinburgh, and I'm currently enrolled in a PhD with the psychology department at the University of Sydney. So my main interest really in behaviour is all about connection, attachment science, and relationship. And just through that, the biggest caseload I have actually, a lot of them involves chronic pain cases because it affects the relationship so much. So that's how I kind of come across a lot of these cases. And as we know, like 80% of a lot of the behaviour cases do have some sort of a medical condition. And I suppose as I was working through my caseload, there came a need that I needed someone, or more like an ally and a colleague. And I suppose that's how Elena and I met and we started working together. So thank you for having us on the podcast. Very exciting.
Oh, it's really great to have you both on the podcast today. And as I mentioned before, we're going to be talking about chronic pain. It's not as easy sometimes to diagnose chronic pain as it is to diagnose acute pain. And there's been a significant amount of talk in the veterinary literature, as well as in conferences and professional discussion forums over the last few years, but I think it's gaining momentum about chronic pain in both dogs and cats and its impact on the well-being and health, particularly as animals get older. Just as in humans, chronic pain is frequently expressed in behavioral adaptation or modification. In humans, we complain more. I think we become less mobile. We seek medical attention more frequently. But in dogs and cats, they sometimes lack the overt communication tools that we as humans have. So I want to talk about how animals express pain and how we, as their human caregivers and medical professionals, can recognize it a little bit better.
Yeah, I mean, dogs and cats are so resilient. They're very good at hiding pain, especially in younger dogs. Sometimes in older dogs, we recognize chronic pain or even acute pain as that we associate it with like vocalization or not using the leg or some sort of dysfunction that you can tell very clearly. But actually, in real life, especially in all of our like more younger animals, like even 1 or 2 year olds, really, when they experience pain, especially in chronic pain, they don't go, ow, or like, I'm not using this leg. They actually adapt around it. So they use everything they have in their body so they can still function. And so then they really do hide in plain sight, like all the signs that you need to know, which makes it does make it very difficult. And I'm really glad we're having this conversation because advocating for dogs is one of my favorite things to help them be understood. And I think what makes it challenging is like inherently one of the biggest thing is our patients make it very challenging to recognize. And the second thing is, as a vet, I think we don't necessarily have been exposed to the skills, the observational skills that we need to actually recognize all these sites that are like quite hidden. And a really common, like we've got a few cases that we've worked together, but a really common one that comes to mind is a border collie called Kitty. She first came to my practice because her mum noticed that her dog started chasing cars, and then it went on to chasing school buses, and then it went to chasing any bus, and it would even know like buses arriving before they turned around the corner. So it was making the walk that, the border collie did need the walk, but it was making the whole thing quite challenging. And then apart from that, she started noticing other signs of like all of a sudden this dog wouldn't go out in the dark, started shaking, scared of like plastic bags. And then sometimes she'll bark at dogs, but other times she seems to have a good day and remembers all her training and doesn't bark. So we kind of embarked on this little journey a little bit. And because she's a pretty good client in terms of she has the skills of doing all the training. So we knew maybe it's not to do with, the skills of the carer or the dog's training. So we looked a bit deeper and I could notice a few things. And that's usually when I start noticing a few things, I go, I think we need a physio to go deeper. And so Elena also knows Kitty very well. She had a look and she identified a few things. We started on physio and pain trials first to kind of really investigate it. And then we eventually found out as time goes on, these are very interesting cases too. Sometimes these cases do get better with behavior support and pain management, but there are times where they do still regress. So this was the case for Kitty. Like we're going well, and sometimes we had bad days and then good days, and then all of a sudden more bad days. So we went into kind of the more diagnostic realm of having x-rays and things done, because now she was actually holding her leg up. And she actually had a partial cruciate tear. And once we kind of had the treatment for that, essentially all the things that, scared of the dark, reactivity to dogs, chasing cars, they gradually just went away as she was feeling better. So it is as magical as that. But they're the cases we really want to bring kind of to the forefront, that it is very challenging to recognize sometimes. And we, like, without those skills of recognition, it's hard to like divert or put the patient on a pathway that's on the right course. What's your experience actually, Elena, about all this? I'm sure you have many insights because you deal with this a lot.
Yeah, I mean, I guess my experience at either end of the spectrum of how physical presentations link with behavioral cases. So on one end, I work with a lot of dogs with like clear dysfunction, so resulting whether that's from an injury, be it orthopedic or neurological, or whether it's after surgery or rehabilitating a diagnosed condition conservatively. Where in these cases, on assessment and discussing with the carer, there is always a reported subtle change in the dog's behaviour on the lead up to the event of the injury, that maybe at the time it wasn't particularly noticed, but they realized that on reflection and after me probing a little bit. And definitely with the cases that have had an injury or have had surgery, there's always this noted behavioral change within the dog, whether that's they're more anxious or they're more tired, and like I don't know, they take themselves away a little bit more. But essentially, they're 9 times out of 10, there's a change in the dog's behavior, and whether that's them just needing reassurance or being more reactive, there's a change. And through physiotherapy treatment, this behavior typically goes away and the dog returns to their pre-surgical or injury behavior. But on the other end of the spectrum of my cases is working with significant behavioral dogs. So with these are the cases that don't have a clear physical dysfunction, and it's more of a subtle but still clinically significant compensatory movement pattern, which helps us understand that maybe the dog isn't just behavioral, but they're actually managing a chronic low grade physical issue, which is either contributing or driving their behavioral presentations. And by again treating the physical compensatory movement patterns or asymmetries, consequently their behavior improves. So that's like a holistic treatment in both of those things, because it's not just physiotherapy. There's obviously other specialists at hand involved with these cases. But a lot of the cases that we work together illustrate that there's typically two common misconceptions within this like recognition realm of chronic pain. And one of those being a lot of professionals see a functional dog and therefore assume that there isn't any pain involved. And the second would be that behavioral symptoms are labeled as behavioral issues and therefore they're referred for to a dog trainer instead of investigating and then going on to treatment. And essentially with these cases, we really need to keep in mind that we can't train away pain. So in that journey of pain not being recognized and they go for training to manage the behavioral issue, there seems to always be this ceiling of behavioral improvement as the root cause or the driving force of that behavior isn't being addressed. So again, it's highlighting that it's those cases that really need that extra little bit of layer of investigation. So all of this sort of demonstrates that it's not the vet's unwillingness to diagnose. I really want to make that clear, but it's more the challenge again around recognizing the subtleties and variability of behavioral signs of chronic pain, as it is, as you've mentioned, such a skill that's required to recognize these things.
You know, the information is so interesting. I wonder if we can dive into some of the specific tools that we as animal health professionals can use. And so what I'm getting here is that do we have specific evidence-based assessment tools for helping us assess patients with behavioral alteration that may be related to pain?
Yeah, there definitely is. It's always a work in progress in science, obviously, but the current diagnostic recommendations from, say, the World Small Animal Veterinary Association and American Animal Hospital Association, AHA, they actually advocate for a multi-dimensional approach, as you say, like a Venn diagram approach, because it is so complex. So it involves, like, this approach involves mainly, there's a few things. So they're saying that the integration of caregiver history and observation is very important. That's number one. And then there's actually some validated measuring tools, so like little surveys and things that are for client reported outcome measures that you can measure certain metrics to assess whether, a patient might be in chronic pain. Then you've got your classical, the physical exam, neurological exam, gait assessment, the diagnostic imaging, whenever you get more of these clues and it points you to a certain direction. And then most importantly is really a response to treatment trials, so our pain trials. So they're the main four. And out of the four, all the experts say within this framework, it's actually the caregiver's observations that are actually the cornerstone of assessment. And I think that's the tricky bit because the caregivers actually are a wealth of information. They just, and when they tell you, sometimes they don't know that's relevant. So if a vet doesn't know that that information is relevant, then we will miss it as a case for chronic pain is what I find the most. So I don't know if that's your experience as well, Elena, about chronic pain
Yeah.
in
I mean,
assessment.
absolutely, absolutely. Going back to, yeah, I mean, I always say that the carer is the one that knows their dog the best. And I
Yeah,
actually have a lot of clients that disclose at times that actually they feel a little bit crazy or a little bit overbearing about their dog's presentations.
I've had that too. Yeah,
Yeah, because they take
like they're seeing
their
things.
yeah, and they say they think they're not sure if it is relevant, and if they do think that it is relevant, then maybe there's like that disconnect of the professional that they do take their dog to, not thinking that that is a significant finding. But so they might take their dog to the vet that essentially they try and bring these areas of concern to the vet. And it's not that there's this like translational barrier of like language, it's just a translational barrier of whether the vet thinks that it's
Relevant.
clinically relevant. Exactly.
Yeah,
And
where
then
it's ticking the boxes of like, oh, I need to do this.
yeah, yeah. And then marrying that up that sometimes you'll take your dog to the vet and the vet will assess them and the dog doesn't react to their crazy changes between passive range of motion. There's no major ligament laxity. So overall, that vet can only from their assessment say everything's okay. And that's so fine. But we know that there's so much at play there that dogs can get quite stressed when they go to the veterinary clinics. There's a lot of adrenaline, cortisol. So we have a patient that might actually be in a fight, flight, or freeze response. So they might not actually react to that palpatory assessment. So again, this just creates this issue where the carer is saying that the dog might be harness aversive, for example, or hates being touched over their lower back, or keeps stopping on walks, but the vet can only say the dog looks fine to me. So an assessment tool that we can also use, as I mentioned at the start, this online gait analysis can be part of this assessment process. And it's been a fantastic bridge
Yeah.
of exploring the why behind these behavioral changes so that we can marry this up with the carer's report and then utilize the asymmetries found within this gait analysis for the vet to then take into consideration during their assessment. So this gait analysis can act as both an assessment tool and a report. And essentially it's using slowed down video footage of specific videos of the dog moving in their own environment, which enables me to pick up these subtle gait asymmetries or what is outside of normal, which points towards compensatory movement patterns. And I can then determine where that's originally coming from. So then that document can be used by the local vet for an effective hands-on assessment to ascertain if there's further investigations needed or treatment or suitable treatment. So sometimes that results in the dog going on a pain trial, for example, alongside suitable physio, where the pain medication hopefully increases the dog's capacity to be rehabilitated. And then, therefore, over time, we see physical improvements, and that leads to behavioral improvements as well. But overall, again, highlighting that it's this multidisciplinary, holistic approach that we need because it's not just one professional that can spot all of these things, but we can certainly, educate ourselves within this Venn diagram, as you've mentioned, Phil.
Yeah, that's so cool. And I'm thinking how fortunate we are to be living in this day and age where everybody has a video camera that they can take a video of their dog when they're having an abnormal
Absolutely.
gait, right?
Literally.
I mean,
Yeah.
I'm thinking of this 30 years ago. I mean, video cameras were enormous and people didn't carry them around to the park with them or anything
We
like
don't
that.
know about that, Philip. I don't understand what you're
No.
talking about.
The other
Mine's
thing I
always
was
been really small.
Yeah. The other thing I was thinking of is the actually something I was told as a new graduate, which is again a long time ago, Findy. It was as a new graduate, I was told that, Philip, I was told by a senior veterinarian I was working with, he said, the clients will often tell you what's going on in the consult room, and sometimes you miss it, right? And that's because, and that ties in with what you were saying, Elena, I think before, that a lot of times clients will bring their concerns to you. They'll tell you what's going on, and they oftentimes have told you what's going on, when it's happening, what is happening. But I think as clinicians, particularly as veterinarians, we're under time pressure and those other sorts of things as well. And we have a list of questions, as Findy mentioned before, that we have to get through, and we're formulating all the time in our heads what we're going to do, what we're going to say. Add to that the adrenaline rush, the release of cortisol, the flight, fight, fright response that you talked about as well. Some animals don't show any symptoms at all of discomfort in a consultation room, whereas they'll get outside and 5 minutes later they're showing the symptoms the owner first brought them in for. So I think a lot of these things tie into what you were talking about. It can make life really challenging, but if we're aware of them, and particularly if we're aware of what the information that the client has in terms of their observations, they're living with that animal every day, and so they're oftentimes a wealth of information for us. So I think really slowing down our brains a little bit and taking time to listen to what they're talking about is super important. I'm going to talk more specifics as well, because I know our audience is quite familiar with clinical signs of acute pain, and we focus a lot on this in both recognition and management of patients following trauma, for example, or prior to or following surgical procedures. But chronic pain, as we've already discussed so far, is a little more insidious in its onset, and certainly a little bit more challenging in terms of its expression in an individual patient. We've already talked about the stress response and how that can lead to clinical signs going away. And we could talk about, animals becoming stressed about certain situations. You mentioned a plastic bag, and a dog might normally be able to get away from that. But if they're sore, they can become quite uncertain about their own reactions to it. So I'm just wondering if you could tell me a bit about the clinical signs and behavior changes that you've experienced and that you know of to do with chronic pain or associated with physical discomfort in animals.
Absolutely. So, across the chronic pain cases that Finley and I have been working collaboratively on, we consistently notice that there are 5 observational domains that repeatedly emerge. So, these are physical signs of discomfort, behavioral signs of discomfort, behavioral signs of emotional changes, relational changes, and cognitive changes. But 2 particular stand out as the earliest and most commonly missed, and those are movement adaptations and body sensitivity. And again, this is where the gait analysis really comes into play to pick up these very subtle physical adaptations caused by pain before there is an overt physical dysfunction or lameness that vets are trained to pick up on. So, for example, one of my recent gait analysis cases, the carer signed up to the service as they had noticed a deterioration in their dog's separation anxiety. They also had mentioned that the dog had started to stop on their walks and just kind of every now and again refuse to walk with no clear cause. So they also mentioned that they noticed some fur pattern changes over the dog's rump, and they said that he can sometimes be a bit reactive to touching over his right hip, but again, quite inconsistent with that. They had taken the dog to the vet and there was nothing picked up outside of normal on the vet's assessment. The dog walked normally, there was no lameness, no non-weight bearing, and he wasn't reactive to the vet touching him at the time or moving that right back leg. So the carer wanted to explore this option of gait analysis as they really felt like something wasn't quite right with their dog, but clearly it wasn't crazily obvious. So they did also mention that the dog can be a bit stressed when going to the vets and typically freezes and stiffens up during the assessment. So again, that can tie into the picture of what we've spoken about just a moment ago. But on assessing this dog's video footage, there was a clear deficit in that right hind limb. So he had a reduced push off phase from that right hind limb during his sit his transition, so his sit to stands in particular. And he also had what we call circumduction during his swing phase. So that basically means that he brings his right back leg out and round to the side as he's bringing that leg through the air. And typically we find that compensatory movement pattern coming up when they're trying to avoid fully flexing or fully bending their hip joint. What was also really interesting is that dog presented with a mild increased kyphosis, which in this case was through assessing all of his video footage, it was likely caused by significant deep hip flexor tension, so the iliopsoas muscle. And why I say that is typically those muscles are the ones that over recruit and switch on to try and stabilize the pelvic limb during movement when there's a deficit. So when those muscles are over recruiting, they pull the spine into that mild kyphosis. And again, kind of zooming further out about keeping in mind that he's not particularly happy with being touched over his rump and his right hind limb. That's quite understandable because if he's got like significant muscle tension from those muscles constantly being switched on, that's going to be quite sore. So it's with those findings, there was a high likelihood that his very subtle movement asymmetries, but still significant, were somewhat of a driving factor to the dog's reactivity being stroked over his right hip, stopping on walking, and that increased neediness that they're seeing or otherwise deterioration of his separation anxiety. So while there was no clear lameness or non-weight bearing, these subtleties of movement asymmetries were picked up on. The report was sent to the vet, and the vet decided to put the dog on a pain trial and to avoid taking the dog back to them due to that stress response of how the dog feels in those clinical environments. And having gone on this pain trial, the dog separation anxiety improved, and he has recently started physiotherapy, and the dog's capacity for rehabilitation also improved. So alongside that, his touch sensitivity over his rump is improving, and he's being a lot more consistent with his walk. So he stopped that random stopping. So this is all to show that we don't have to wait for a clear dysfunction or lameness for a dog to yelp or be completely non-weight bearing before addressing this understanding that there is something brewing under the surface. We just need to find those skills of identifying those very subtle patterns. So again, this is all around the significance of chronic pain and the behavioural picture. But Findy, what do you feel around, what do you see between the physical discomfort?
Yeah, I think the behavioral signs I see in terms of that relate to physical comfort is really translating what you see in those adaptations to daily living. So I get the complaints of like,
Yeah.
why is this dog not doing this? And I go, because he actually can't do it. So a very common one is, like, as you mentioned, it's to do with walking, because I think a walk is like almost like a gel between a dog and a human bond. It's like so important for the human as much as it is a dog. So when there's issues around it, especially if it's like quite a physical activity as well. And it actually involves more than movement because you've got harness, you've got like the lead, you're holding hands with mum, you need to kind of figure out what your environment is. So if you really have trouble with your physicality, the walking all of a sudden becomes difficult. The really common one is the walking start stopping, and owners think that they're not good enough in training, or they always say, I'm really guilty. I don't think I've done enough. Or like they go, why is my dog doing that? Like I've been really kind to it. And I'm like taking time off my day to make this walk happen. And
Yeah.
he goes out as if he's happy, and then he sits down and refuses to walk. And then, that's how it spirals into like, oh, I think it's the dog. It's like, it's really naughty, etc. So that's a really common behavioral sign that I think if you see a patient that's coming in for like the owner saying, I can't walk my dog, that is a big alarm bell for me to dig deeper. And then I'll ask, well, how's the harness placement? Because that relates to what Elena mentioned with like body sensitivity and touch sensitivity. There's quite often this history that we take. Like how do you put a harness on your dog? Most owners of chronic pain patients, like once we diagnose them, they'll often say, we do this dance, we do this game. He like is really excited, knows about the lead, and he comes in, and then he darts backward, and then I have to chase him, and then it's like all a big hoo-ha, and then finally we get it on, and he's happy once he's gone out. So that to me also is another clue. As soon as they say he does this thing, and I go, oh, there it is. Like, and then another one I think, Elena, you would probably notice this a lot too, is travel, like car travel challenges, because it requires balance and a lot of like sensory integration because you're in this box that moves very fast and things whiz past you while you need to coordinate. So a lot of those ones is also a really big kind of what I call a behavioral sign of there's something to do with physicality, not just emotional side of things. And especially like those things that you mentioned as well, like we have dogs that are like sleeping really restfully, and then the owner would say every now and then he just like jerks up and then chews on his leg, and I go, oh, that's not normal. Like there's sensations happening. So they're the really common ones that I think it's easy to miss or associate with different things. But in actual fact, if you've had some physio input or had a gait analysis and you also notice physical adaptations, those behaviors are actually the translations of these like kind of compensatory movement patterns that affect daily life living is what you're seeing, which is why I think those are main two domains that we go, well, if you have physical adaptation that's not normal and you have behaviors of body sensitivity, once we have those two, usually everyone like, oh no, oh, this is like real work to be done. We need to dive deeper on all the other domains we need to observe. So I think they're the big ones in terms of the physical signs.
Great.
That I
Now,
notice in my patients.
I guess not all animals are going to show the full spectrum of those behavioral changes because there are, as you've already alluded to, there's other factors that can lead to suppression or in some cases exaggeration of their pain response. So tell me a little bit about some of these factors, and you've done so already, but just to begin with, I want to talk about the behavioral signs that might suggest an emotional change on the part of the dog that's associated with chronic pain.
Yeah, so what's really interesting and integral to know is that the emotional center of the brain is actually the same part of the brain that holds pain perception. So emotional changes are huge clues when it comes to understanding chronic pain, but one of the harder ones to recognize as a symptom of pain. So the presentations are currently seen as behavior rather than recognizing the change as pain. So, and then obviously then that means that the dog misses out on actioning of investigations and suitable treatment. So instead, at the moment, the emotional change might be noticed, but accepted or justified by the family or professionals just from a lack of understanding rather than like not willing to explore what that might mean. But Findy, what would you say are the main emotional changes that you see in dogs with chronic pain?
Yeah, there is actually very interesting because a lot of the emotional changes are anatomically related. So that was a great gem from Elena that she shared with us. It's the same emotional center. So it's a huge clue when you have emotional behaviors that are associated with emotional changes. And most of them is because pain is meant to protect a creature. So when there is pain and it's chronic or turns into a maladaptive process, the change actually changes everything emotionally that is meant to protect the creature as well. So we call them as a group protective bias emotions in the clinical animal behavior, and they would include emotions like fear and anxiety, frustration, separation. So that's our panic and grief and attachment emotion. They are the three biggest ones that kind of tend to change. They really increase either in intensity or what we call, it's like volume, but arousal. And so usually the behaviors that come out, especially if they're associated with pain, and if they're across, like if you can see the behaviors associated with either anxiety or frustration or to do with separation with the caregivers, if they light up, then I usually go, well, that's interesting because all of us, I mean, you're scared of the dark. You're never scared of the dark. Or like plastic bags are usually okay. We know you don't like them, but you don't jump and dart away. I go, oh, that's interesting. That's increased so much. Also frustration. So usually frustration is another emotion that I recognize a lot as a behaviorist, but I don't think people are generally familiar with it. It is a very intense emotion because it's meant to be acting like fuel to push through barriers. So for dogs, it's like they will try and mouth you, grab stuff, or they bark at you when they want things because they can't wait. It feels very personal when frustration comes up. But that's one of those big clues where if you don't take it personally, it becomes a clue to go, why are you so frustrated? Everything is the same. I've not like deprived you of everything. So that's a big one. And then how it translates, obviously, like the common behavioral disorders or things that we associate with, like generalized anxiety, or when they're again demanding, or they have abnormal repetitive behaviors, or separation related anxiety, or fights within the family between dogs that they know, reactivity. So they all like those sort of behavior problems actually, they all spout from kind of this change in emotional state in the animal. And sometimes we don't think of it as pain because we see everything very emotionally and we know that the dog's experiencing feelings, but it's hard to comprehend there's actually a brain change happening. And I think that's what we don't want people to miss, is actually probably a medical condition, a maladaptive change, just like heart failure, but it's maladaptive pain perception that's happening, and that's why we're seeing those behaviors. So, yeah.
Yeah, it's interesting when you've got that maladaptive pain. As I think it describes the situation these animals are in really, really well because they have these sets of behavioral responses to something that then get blown out of proportion. And depending on the situation the animal's in, and we'll talk about relational things as well. And you've mentioned those already, but depending on what's going on, there's the environment that animal is in, other animals, other people, different people, strangers and coming into the house and those sorts of things can all alter I guess, the eventual manifestation of that animal's discomfort due to that maladaptive response. Am I on the right track thinking like that?
Yeah, absolutely. So,
Absolutely.
yeah. So, along to expand on that, the chronic pain, as we keep saying, is very complex. So, in medicine, we use this biopsychosocial approach. And interestingly, we use that concept in human practice. And essentially, it appreciates that chronic pain influences this biology, psychology, and social aspect of the individual, which again highlights this holistic nature of pain, lending to the fact that these cases require a holistic understanding and approach to the patient. So the social relational aspect is also a really good observation to notice and recognize as a clue to suspect chronic pain.
Yeah, and then, I mean, we've already mentioned it, but the really common themes and a common example that happens, it's usually when a dog maybe has tension or conflict or aggression towards a known dog or a known carer. So it's very puzzling because often the cases present with they love each other, and then all of a sudden she just charged at him and we couldn't even tell what happened. And I go, well, that's usually how it happens if you translate it to like a human relational sense, because there is just that relationship difference to that. So it is very much the same for our dogs. They usually kind of redirect that frustration or anxiety or that discomfort to people that they know and they know will support them, or dogs that they are really tight with, because again, they would hope that they'll be understood and supported, and that's why you would do this. Or you're a little bit uninhibited in that point because the relationships are different. So that's a really big alarm bell. The second one, relational changes wise, for a lot of the chronic pain patients that come in, is I often notice that if the owners are actually really sensible, and they, especially if the ones that have like gone through the process of booking in to see a professional, it's very out of context that they've tried so hard and that the dog's behavior is still so challenging. And I often remind them that it's actually not them. There is something definitely deeper going on, because there are people that are not like them that still have dogs that are fine, that have not put in the work. So for me, when a relationship is a bit, or the behavior is really out of context for that relationship, that also kind of flags to me to go, oh, I think there's something else, instead of just training or the behavior being not addressed properly per se. So yeah, that's those two are the really big ones that I often see in terms of relational changes and signs of chronic pain.
Great, thank you for that. Now, we mentioned right at the start, there's this big spectrum of behavior and pain and that intersection and so on. And is it possible, and I already know the answer to this question, but I'll ask it anyway. Is it possible for an animal in pain not to show significant symptoms? You've described this a little bit already. That can make a diagnosis or a definitive diagnosis of chronic pain a little unclear. How do you go about approaching those cases where there's, not that many clinical signs, it may be vague clinical signs, but you're not able to isolate pain? Or there's maybe behavioral symptoms. You can't necessarily identify pain, but you think that maybe pain might be there or not. How do you approach those cases?
Yeah, I mean, definitely, it is so important to recognize that not all cases will present with a clear diagnostic confirmation at this stage. But the most important note here is that the absence of a diagnosis does not mean the absence of pain.
Yeah, and I think sorry, it's actually the vagueness and the kind of not finding a diagnosis at the first kind of point of recognition is actually more common than it is uncommon as a pathway journey for chronic pain cases. And when we don't get a diagnosis, often, as Elena said, it doesn't mean that there's no pain because pain is an experience. And if the behaviors, like what you observe in terms of behaviors and physical signs, they're all still translating to there's brain changes and it's associated with chronic pain. To me, I often then go, well, that's all that means. If the dog is always right or the cat is always right, if they stay uncomfortable, it means the journey is not over. We just need more time. We need more information. Sometimes we need more expertise. Like often, Ellen and I, it's not just us as well. We have a whole village for most dogs. It includes carers, that includes dog trainers, behaviorists, and we'll all just kind of collectively put our brains together and go, let's see what else we can observe to find more clues. Because it is a very, it's almost like a subclinical state sometimes that you find these dogs in, and the behaviors are like they're communicating and saying, I don't feel good. And if they keep saying that, it means like our job is really not over as their support village.
Right. And you find that actually in clinical medicine as well, that sometimes things become
Yeah, sure.
apparent as time goes on, right? Because sometimes an animal will
Yeah.
present with clinical signs of illness that are vague and non-specific, particularly in feline medicine, right? It's just lethargy and anorexia being
Mm,
the symptoms of every disease in a
yeah.
cat, almost. But
Yeah,
sometimes
sure.
you'll
Oh,
uncover an abnormality, and other times you won't. I
Yeah.
have seen animals in
Yeah.
which I've been sure that maybe they've got pancreatitis. We've done blood tests and ultrasound, whatever. It hasn't, nothing's come up. 2 days later, we re-ultrasound the pancreas, and there's the pancreatitis sitting right there. And so the benefit of sometimes time, because and we're obviously expanding the time frame here, because these things oftentimes develop
Mm,
quite slowly, but giving more time can enable you to get a little bit more information there as well from your patients and the clients as well. And that can help on the journey. As you said, that your job is not done as a veterinarian just because at time equals X, you were not able to make a definitive diagnosis. It's worthwhile the follow-up. So how frequently, I guess this is going to vary depending on the patient, but
yeah.
follow-up examinations and those sorts of things, they're clearly going to be an important part of the approach to these patients.
Yeah, it is. I think a typical timeline, what I usually experience in my cases, or I tell owners when we first start a case and explore, is to expect about at least a 4 to 6 months of kind of initial stabilization from this kind of peak. Oh, everything's happening, it's normal, we don't know what's what, but we know maybe it's this. Takes about that long to really observe and practice those skills and give time for the dog to tell us a bit more. And then within it, after the initial 6 months, it really is very individually, like we go by individual, like what kind of they tell us as to how often we get follow up. But my experience would be usually between 1 to 3 months and depends on their life and kind of what expectations are on within this relationship. Some sometimes it's the carers they have needs. They're like, we're moving house in like maybe 10 months. If we stabilize 6 months, can we talk to you in another 2, 3 and work towards this goal? Because now we know what's relevant and how to apply. I think it'd be interesting to know actually from your perspective, Ella, because you do physio, it's a bit more of a protocol. Do you see more like predictable timelines
I
in your
think,
patients?
yeah, I mean, I'll echo what you said that it is really variable on the whole family unit. So outside of those social considerations, it also depends on where that dog is on that journey. So if they've been holding chronic pain for a very long time, typically we find that their nervous system is very heightened. So they're just about managing their day to day. And even though physiotherapy is suitable for that dog because they have this physical limitation that we want to address, it's actually the rehabilitation that could be the straw that breaks the camel's back. So it could be that that's what tips them over the edge. And then we actually see behavior getting worse. So in those scenarios, we have to tailor the physiotherapy to be even more specialized to address more of their nervous system regulation, again, alongside the input of a vet behaviorist and potential medication to increase their capacity for rehabilitation. So in those scenarios, it's really dependent. It's like this, like I describe it to my clients as like a fine dance, as like I have to learn the dog and learn their response and how they're and essentially it's so we have to adapt depending on how that dog responds to the input. Once we've got the wheels turning in their rehabilitation journey, I typically say 3 to 4 months because just like anything, but specifically physiotherapy, it is not an overnight process, and I wish it was, but it does take consistency from the carer or whoever they have on board to do the rehabilitation, yeah, to see the results. So sadly, it's not an overnight journey, but I think it's really important to A, be aware of that as a professional, and B, have that open communication or that like of open expectations for that family unit. Because when we have these cases, they're in pretty dire situations because they need help and people want a quick fix. And it is really important that we kind of hold them in that supportive network and support them along that journey as they navigate the changes of chronic pain.
Yeah, it's an education. We have to educate people about what to expect because we do live in a very now. I want the answer, I want the solution
Exactly.
now
Yeah.
sort of
Yeah.
society, right?
Yeah.
So and we're not dealing in a quick fix for a lot of these patients either with either the behavioral aspects or the chronic pain aspects as well. So look, I want to thank you both for spending time with us, but before we go, I do want to let you know that Vet Education here, we are very excited to be working with both of you to deliver an on-demand, and that means for those of you who are listening, you can do this course at any time. It's an on-demand course that will support you as a veterinary professional to confidently recognize the functional and behavioral indicators of chronic pain so that we can act earlier for our patients to improve their quality of life. And there's so much exciting about this course. We've only really just touched the surface in this podcast. So I'm wondering if you could share just a little bit with everyone who's listening about what they can expect from the course and how it might benefit their patients, the owners that bring those patients in, and also to help our roles as animal health professionals as well and animal health advocates.
Thanks, Philip. We're so excited to be collaborating and like having this course on the vet education platform. So what we made is an on-demand course. It comes in 3 parts, so it's easier to follow because there's actually quite a lot of observational skills and information to know. So it's a 3-part course. Part 1 is really about like the recognition. That is like the most important bit to start a journey, is to realize what signs are relevant across those domains that we mentioned. Then part 2 is like the diagnostic pathways and the pros and cons of each kind of diagnostic component that you can use that are currently within the guidelines and evidence-based. And then part 3 is all about kind of the treatment and therapeutic components that you can mix and match according to an individual patient or relationship that you're dealing with. Yeah, Elena, you tell us more.
Yeah, so each part has got 4 on-demand modules to go through everything you need to know. We've kept them fairly bite-sized and digestible, so they range from like 30 to 45 minutes each. And while it is on demand, it's very interactive, lots of case examples and videos to build your observational skills. There is also, very excitingly, an optional live tutorial module at the end of part 1, 2, and 3. And this is where clinicians can run through real life cases together with Findy and I and test their observational skills. So Findy and I would really be happy to run through those cases and guide you through them. So we would encourage you guys to sign up to those.
Absolutely. And I can assure I'm not alone in my thoughts that with the two of you leading these discussions, the potential for a massive amount of knowledge acquisition is huge. And I really love your enthusiasm for what you're doing and making a huge difference in the lives of the animals and the people that you encounter. So thank you so much, both Elena and Findy, for joining us on the Vet Synapse podcast today. Take care, everyone, and see you next time.
Thank you so much. Take care.
Thank you for listening to this episode of Vet Synapse. If you like this episode, please subscribe to the podcast and share it with your friends and colleagues. Make sure to visit our website, veteducation.com.au, for more great content and to experience the latest online race-approved veterinary continuing education.